In many parts of the world, child marriage, where at least one of the parties is under the age of 18, remains common. The problem is particularly acute in South Asia, accounting for 45% of the total number of child brides globally. 3 in 4 child brides in the region give birth while they are still adolescents. Over a third give birth before they turn 18. Child marriage means the end of childhood. It is a harmful practice that perpetuates cycles of poverty as girls usually drop out of education. Their physical and mental health is threatened, and child brides are at a greater risk of experiencing dangerous complications in pregnancy and childbirth. Child marriage is rooted in gender inequalities, social norms, and poverty, as well as the lack of opportunities for adolescent girls in the region. The United Nations Population Fund, UNFPA, works hand in hand with the United Nations Children's Fund, UNICEF, on a global program to tackle child marriage in countries with the highest prevalence, including several South Asian nations. The global program partners with governments, NGOs, and other stakeholders to advocate for ending the practice of child marriage through enabling policies and legislation, while offering practical support to promote gender equality and the rights of adolescent girls through a variety of programs. It also aims at strengthening education and sexual and reproductive health services that empower girls. If girls and young women are encouraged to avert early marriage and pregnancy, they can achieve their aspirations through education and work, empowering their own futures and boosting society economically while helping break the cycle of intergenerational poverty. While a great deal of work still needs to be done to eliminate child marriage in the region, the program has already had great success changing the lives of many young women in South Asia. In Nepal, training and life skills for young women, outreach and dialogue with families and communities have played a role in enhancing opportunities for girls while raising awareness of the issues around child marriage. 18,000 girls have undergone training in social and financial skills, with 80% of graduates going on to be enrolled in formal schooling. The program will now be digitally scaled up. New policies in Bangladesh have seen more than 80,000 marginalized adolescent girls, some already married, receive training in transformative life skills with a focus on sexual and reproductive health and rights. Behavioral change campaigns targeted 1.2 million people, including fathers and husbands, to show the benefits of female empowerment for households, the economy, and society as a whole. The focus on training and life skills has also been useful in India, with 14 million adolescents being reached with messages on marriage and gender-based violence prevention. 400,000 girls in 15 states were supported to continue into secondary education. 1.9 million men and boys were brought into group dialogues to learn about harmful gender norms. Across South Asia, the program has helped change the future of young women, girls, and boys at risk of child marriage, while reaching out to wider communities to change traditional mindsets. The work will continue with the global program, helping to align key players in legal, education, social protection, and health to encourage behavior change in South Asia, ensuring that the practice of child marriage is phased out and that every young person can reach their full potential.